Hey, I'm Sarah Smith, family doctor, clinical day advisor, and the chatting coach. Welcome back to Sustainable Clinical Medicine podcast, where we're going to be interviewing peers or world experts who can help us think about our clinical day in a way that is more sustainable and create time for our lives outside of medicine. Hey listeners, I value you being here. Please, I encourage you to leave a review. I'm going to be reading out a review each month, and that person can have a one-on-one call with me to have a chat. And I think that is a great way to reward you as a listener. Also, as you like and subscribe to this podcast, it helps get our message out to other physicians and clinicians who are struggling. Thank you so much for your reviews, and I look forward to reading them out here on the podcast. Hello, everybody, and welcome back. Today we have with us Dr. Cynthia Chen-Joea. I'm so happy to see you here. I'm looking forward to this conversation. Welcome.
Thank you. So happy to be here. I can just go ahead and introduce myself.
Sounds good.
I'm
Perfect.
a double board certified family and obesity medicine physician, medical educator. I'd say teaching is part of my core values. So I'm a medical director of a multi-specialty clinic in a private practice, and also faculty at a family medicine residency program. And then I'm also a physician career and life coach. And I work with, I would say my biggest mission is to let people know that medicine can be completely sustainable. So I work with doctors and helping them redefine what that might look like in terms of maybe their identities or the multiple shifts in their identity. I do a lot of advocacy work on the local, state, and national level. So I think physician wellness is something I feel really strongly about fighting for. And I would say coaching is my way of like providing that one-on-one, just like patient care. And also on an advocacy level, I think creating institutional and systemic change that can support that as well.
Love it. Love it. Okay, tell us a bit about you in your career along the way.
Yeah, so I was in academic medicine for a while, and a little over a year ago was when I decided to resign, and that really, all of that really propelled from getting pregnant. So my first baby, right? And I think like so many physician parents, that it really changes your whole life and I think gives you a new reprioritization of what's important to you, right? And that can change again based on the phases in my life. But in that particular phase in mine, made me realize how important it was for me to take care of myself, not for myself, but of the baby growing inside of me. And that was kind of my start into coaching. Before that, I just thought, when we talk about burnout and or I say work-life harmony, right? I think people go through the cycles and cycles of burnout, and that is not a unique story from my own. I think every physician has gone through that. But also when you have a kid, and for me, that was the most important thing was actually being there and being present for her. It wasn't something I wanted to bring home. And so I ended up deciding to leave my full-time position at that time and kind of started a journey, a path towards, I don't want it to sound cliche, but really it was a path towards figuring out what I wanted to do and learning how to listen to my body again after um, having that trained out of us in medical education. And so really looking at, when I look at medical education, I kind of I see it as a way that trauma has been introduced in all of our lives. I really think culturally and medical education, the way that we have been teaching students and learners is not necessarily, it's the way that always has been done, but it's not necessarily the healthiest way moving forward.
Yeah. Can you give us some examples of that, where you might have seen the pre-medical student to physician transition include areas that aren't healthy and aren't good for that learning person?
Yeah, I mean, I can talk about my own.
Yeah, that's
um,
fine. That's fine.
I assuming this is not a unique story, but a lot of my rotations as a medical student was at a county hospital, and we had surgeons that threw knives at us or ripped our notes on our rotations up right in front of us, calling us names like lazy or, this and that. I remember one time a surgeon, it wasn't to me, surgeon had ripped up one of my colleagues' notes in front of him, called him lazy, called me lazy because I had forgotten one sticker to paste on a patient chart for their note. Back then, it was still paper chart. And it is, I mean, obviously very judgmental and not right when we think about that. And when we think, in medicine, we say see one, teach one, do one. So we saw that was how people were, medical students were treated. Some people grow up thinking, yes, that is just the hierarchy of medical education, like hazing, and this is what happens when you're a student or then you're a resident, right? And then you are the one that could potentially be propelling that cycle all over again. And so, I mean, one of my goals, like my vision, right, is if we could retarget medical students and residents in terms of their medical education in a way that supports physician wellness, equality, learning in a healthy, empathetic, resilient way, that this is where we could really change things in terms of medical education or the medical culture, I should say, of saying like self-sacrifice is being a good doctor, or like martyrdom as being a good doctor, staying until 9 or 10 or 11 a.m. charting in the office as being a good doctor, right? In reality, I don't know, I don't believe that that's the case.
Yeah. Okay. Thank you. They're just helping us understand what do you mean when you say that there's areas of harm and trauma happening. It's like spelling it out helps us to understand us in the story, which is really important. What about when you got into your day in the life of?
As an attending.
Yeah. How are things going?
So, um, are you referring to, oh, okay. So
Yeah,
yes, I
did you
understand your
enjoy
question now.
it?
Yeah, it's interesting. I think in my early career, I would have to admit that I was not aware of all of these things that I talked about. And I thought, yeah, residency is hard. And of course it's hard. And working
Mhm,
these long hours is just something we have to go through.
mhm,
And all of us have to go through this as a rite of passage. And that's why we come out the other side being good doctors, right? Um, and I think elements of that is true. And also, I think we can also question some of these thoughts, right? So, if this is what you're taught, that self sacrifice, putting yourself last, is what you're supposed to do to be a good doctor, it does 100% follow you into practice. It doesn't just magically disappear. What you're taught with, all of us as children, we grow up with as adults, right? So in our practice, for example, I still put myself and my body last, and I am still learning every day to eat when I'm hungry and drink water when I'm thirsty or use the bathroom when I need to, right? And I think that comes from um, when you're looking at medical education as a form of trauma, right? And our response is like the autonomic survival responses, right? Fight, flight, freeze, or fawn. Physicians are so good at the fawning portion of it. And that is people pleasing, for example, or it's perfectionism. And so I think that is why moral injury and burnout is so common these days, because that is the foundation and basis of our beliefs. Are we want to do more, and we want to please others. So when we are asked to see one more patient or fit another patient into my schedule, or and do this and answer all your inboxes and complete your chartings, right? And because of our oath, we say yes, yes, and yes. Um, and so you can imagine when you're pushed past that breaking point, how would you actually show up for for your patients? Your patients can feel that you are not there. And if you are modeling that ignoring your own needs, that in and of itself is a lesson for others around you, right? Then your patients are thinking that that might be the right thing to do. Your colleagues are thinking, your medical students, your residents are all thinking that. And so to me, I really think part of breaking that cycle is actually just modeling it, and giving yourself permission to rest and to breathe. And when you do that, I think you show up in a very different way. Things that you're able to offer, like your presence, your compassion, your empathy for your patients, um, is so much more valuable and what's the word I'm looking for? Like palpable for them to understand that you truly care about them. Um, and I think that's what patients really want at the end of the day is just to feel heard.
I know that if I watch the cycles of burnout that I've been in, that empathy piece, while it might be, I like to not think that my patients can see it. Having listened to you, I'm like, oh, maybe they were seeing it. If my brain would say, oh, not another one, or oh, why
Uh,
is this so hard, or oh, do I have to? Um, that losing that empathy, while I could still say professionally all the right things, the inside was withering by having to
yeah.
see another patient kind of thing, right?
I think it's something our patients can sense. I can't tell you the number of patients that I see that have told me, I think my doctor just doesn't care, or that person just doesn't care. He just brushed me off, or she, X, Y, and Z. And my response always is, no, I think they care. Maybe it came off a certain way, but I do think they care. And I really believe that. I think nobody came into medicine to go through, you know, all that training and residency and, all of it to because they didn't care about doing what's right for the patient. It's just based on how our medical institutions, the conditions that many doctors are practicing under, the evolution of medicine to, I would say, more of a business now, corporate medicine, it has trained the empathy and compassion out of many physicians.
Yeah, yeah. Tell us about your discovery within that coaching space. What was it about the coaching that really triggered or empowered or enlightened you about the way you're working, or why did you get interested in it?
That was when I got my first coach was when I was pregnant, my postpartum period. Oh man, that was the hardest by far time I've ever had in my life, with mental health and dealing and like having a newborn. And I was transitioning back to, or I knew I was going to be transitioning back to work. And the feeling of, like, absolute dread, I realized was not normal because 'cause I've talked with other people, your physician colleagues, and that was when I sought out my first coach, and, I haven't gone without a coach since then because I just saw how powerful and transformative questioning those thoughts, expectations that you have of yourself or medical society has of you or culturally even, um, how people see you as a mom or wife or daughter, um, and really coming from a place of wanting to, um, provide all the love and support for my newborn and not wanting to be in a place of, anger, frustration, pain, um, and so I really delved into coaching. And of course, once you experience the transformation of that, you want to give back and have everyone experience that. And so, a little over a year ago, after I had left academic medicine, my full time job, I started my own coaching company, and I think it's just grown since then. I've sought I think training after training, wanting to learn more and for my own personal and professional development. And it's just my life is very different in a much better way than what it was a year ago.
Yeah, yeah. Can you tell us about that, the dread and the anger and the overwhelm thinking about returning to work? What was the shift? So what changed that allowed you to say it's okay that I'm not going back, in that same capacity? Can you walk us through kind of what that looked like, if you can articulate that? I know that's going to be really hard on the other side of it, but
Yeah, I'm gonna
understand.
try. I'm definitely gonna try. So I did go back to work for,
Okay.
I want to say, a hot minute. It was maybe like 4 weeks, and all of the um, thoughts and frustrations and feelings and anger came very quickly back. Versus the time that I was away from work, I felt happy and peaceful and joyful.
Hmm.
Um, I won't say all of it is because of the institution that I was at. I think it was
Hmm.
probably a combination of both, a misalignment of values of the
Hmm.
institution
Hmm.
and also my brain, right? And
Hmm.
what I was telling myself. And I've done a lot of work in coaching since then, but I'll say a big thing is one of my values that I have learned is autonomy and wanting to um, serve others, patients and physicians, in a certain way that I couldn't do, wasn't allowed to do. And when you look at, let's just say patient care, for example, because I think that's something all of us identify with. When the choices of how we provide patient care is based in money, and I understand that being a business, I do understand that. But I think when it affects patient care, when it affects physician wellness, ability to provide preventative care, for example, all of my really core mission and values that just didn't quite align. I couldn't support those things and bring those together. Um, I felt like it was the time to walk away and being able to practice in the way that I hope to practice with autonomy, the way that I feel like patients deserve the type of care, was something that was really important to me. And I would say that was part of the reason. Yeah.
Yeah, yeah. And then there's an identity shift. If you're now changing into a new role, that would have been hard too.
Yes. And that's something, it's really interesting because I didn't realize that. There is so much grief involved when it's like a divorce. You're breaking up with a place that you've been so deeply ingrained in and shifting to a new identity of what it means like to be a physician now, right? And I think that has shifted multiple times for me this last year. Your idea of what it means to see patients or be faculty. I'll just use the faculty one because that was a huge part of
Hmm.
my identity is teaching.
Hmm. Hmm.
Um, that was really, really hard for me because I really had to be granular and look at the reasons why I loved being faculty, what it meant, right? And it's not just the title, but it's about um, imparting something onto the world, onto the next generation of physicians, um, that hopefully makes the world a better place, that hopefully improves their education, through your modeling and um, how devoted you are, let's say, to your specialty, to your patient, to your patients, to yourself. I hope that that's something that we can, for me, that's important. That's something I want to impart onto the next generation of physicians. And so to say that I couldn't do that anymore was a huge grief process for me. And I had to look at, well, what are the other ways I can continue to do that? And I experimented, and I think that's also part of course correcting when you're looking at sustainability is figuring out and trying new things of what makes you happy, what brings you joy, what lights you up without you being a martyr or it being super draining for you. And so that's been part of my experimentation also this last year is looking at, is it like utilization? I tried that for a little while. I tried, several different non-clinical work. I tried private practice, which I'm still in. I love the autonomy that I get to practice there. And I think that's something if I could go back and tell myself, it's just not to be afraid to try new things. And of course, it's scary because something new is always going to be scary, and also, um, it could be so, so incredibly rewarding if you do find the thing that you were always meant to do. And I think there's always a little bit of fear in doing something new that's really vulnerable to yourself because it means more if you fail, right? If you
Mhm,
don't succeed
mhm.
at it. And also, we can look at failure as an opportunity of learning too, which I've done a lot of this last year.
Totally. Adult learning is all about failing, although not we redefine failing as a physician. You don't want to fail in regards to patient care and doing your best professionally. But when you're trying out new things and new roles and new ideas for yourself and your identity, you're right. You're supposed to show up and not know how to do it day one. That's part
Yeah.
of a fail. And it's also I thought I wanted this and I don't. There we go. That's another fail. So these are parts of like you said, the experiment, the course. I love course correct. I think that's a really lovely way of saying, what else could I be? How else could I do this? How can we course correct to keep the bits that I like, but do it in a way that's more sustainable for me? So such a good lesson.
Yeah. Always course correcting. And I think before I had learned all of these things, I was way, way, way off course, right? Like into the depths of burnout over and over again. And I think now that I am learning to really listen to myself and my body, that course correction happens so much faster. And I'm able to acknowledge and recognize um, feelings, thoughts so much quicker, do a lot of self-coaching. And I think as a result of that, have built this, and I would say I'm still on my journey, but I have built a life that is incredibly rewarding for me, both time-wise and mission-wise, that really reflects my values. And so work doesn't feel like work. Um, Work feels fun and exciting and something I'm really drawn to now.
Love it. Yeah. Tell us about some of the work you're doing with physicians now and what you've learned there in that space.
Yeah, so we are, I would say, in the coaching realm. These are all the things that we talk about pretty regularly: imposter syndrome, burnout, moral injury. Um, I love boundary setting because I think that comes at the heart of so many things when our boundaries are being pushed and pushed and pushed. Um, and I'll say, like, my non-negotiable boundary is I have to be home every day, right after work at 5 to have dinner with my family and put my kid to bed. That's my non-negotiable. And everything else kind of happens around that. So I would say, what is one thing for you, if you could do just one thing, one small thing, and it could be today, every time I'm thirsty, I'm going to take a sip of water, right? Or
Mm-hmm.
today, every time I have to use the bathroom, I'm gonna stop what I'm doing and just go.
Mm-hmm.
If you did one of those things every single day for 30 days, how different would your life look like in a month or 6 months or 9 months or a year, right? Your life would be completely different. Um, and I feel like that's what I try to do now, every single day, such that when I look back on myself a year ago, it's completely unrecognizable. And I think it's those small little micro steps added up that creates a huge difference that can help you build that sustainability for yourself in medicine and in your life. And I would say that's a key value lesson of what I tried to teach physicians I work with. Um, and also doing a deep dive and questioning a lot of those expectations that we were taught in our medical training and our cultural conditioning, and looking at it from, I would say, a trauma informed lens of like what activates us and what is able to bring us down. We talk about all of those things too. And also, if you want to do a deeper dive, I'm actually hosting my first woman physicians retreat this October in Arizona. And really am excited about sharing everything I learned because this was a long process. All the lessons I learned, and I hope other people don't have to take that long to learn it. And so, really, this retreat is a full immersive process with me and my colleague. She is EMDR certified psychotherapist, and we'll be going through a lot of exercises and kind of relearning the lessons that we were previously taught. Um, and it's going to be amazing. I think everyone is going to leave transformed.
I love that. Yeah. So when we're talking about that trauma-informed lens, we're talking about taking a good look at how our body's responding to the asks of the day, yeah, and then having that step back process of saying, how can we identify areas that are hurt, harm, scars, injuries, and how it's affecting us in our day to day.
Yeah, I think it's coming at it from the lens of these were the experiences each of us had,
Mm-hmm.
right? And the first step, acknowledging, realizing that you are becoming activated. And so let's hit the pause button there. Like
Mm-hmm.
you had mentioned, step back. There are specific tools and exercises that we talk about. We actually do by every other week a workshop around this, my colleague and I. And these are things that you can do also if you do find that activation. I mean, there's sensory things that you can practice, stepping outside of the room, taking a walk. Um, EMDR based exercises,
Mm-hmm.
I would say bilateral tapping and using that pathway, the binaural pathway between the left and right brain to help you shift from that activation state. Question with curiosity what the thoughts you are having that put you in that state and being able to slowly come down from that state.
Mm-hmm.
Um, and it's really interesting when you dive, I think, into the background of why that happens. Like it is incredibly sensitive and not specific, right? So I found myself before I kind of dove into all of this work, being in, let's say, medical executive committees, being in meetings with a round table full of very experienced older men becoming incredibly activated. And why was that the case, right? When your alarm bells are going off in a setting that is not um, actually an emergency setting. And so, why was that the case? And I've delved a lot deeply into that work too. And so it's very interesting to me. And you look at, anyone's personal history and the response is always, well, no wonder based on what you experienced that was your reaction. And how
Mm-hmm.
can we look at that, go back and come from a place of connection and relationship and healing and redefine what it could look like for you or how you want it to look like for you moving forward, right? And I think that's really um, part of the healing process too, is talking about all of the.
Yeah, yeah. How would we know if we were experiencing trauma or activation in our day? So how as a listener, we're going about our day and we're not sure if we need a trauma-informed retreat. We're not sure that we're having panic attacks on the regular, though that might be something you're having. What does trauma look like? So what are sort of the experiences what does it look like in your body if you're having that type of activation? Because I know we talked a little bit about it, but I'm wondering if we could really kind of help somebody understand, oh, because I know when I did my trauma-informed coach training, I was like, I had no idea I needed this for me,
Mm,
right? I'm doing it to help others, and I'm like, wait a minute, you tricked me. This was for me as well as for others. And so for me, it was surprising that in day to day, there are ways that we can identify our body's responses. And when we recognize what that actually is, we're like, oh, that's my trauma, that's my burnout, that's my, yeah. So can you help enlighten us from your perspective, what you're seeing as that?
Yeah, and I would say it all goes back to your the survival responses is like what I always refer back to. So imagine that you are being attacked by a bear, what that might feel like, right? So the first F, the first survival response, fight. You might feel a rush of adrenaline come out. You might feel your heart starts beating really fast. Sweaty hands, sweaty or clammy hands, sweaty or clammy feet. You're not, there might be alarm bells going off in your head. Um, so those are I would say what you might actually feel if we're talking about tangible things of what you might feel around fight, right? And then there's flight, right? Meaning if a bear is coming after you, I'm gonna run away as fast as and as hard as I can. Again, you might feel that adrenaline rush. These physicians, or I would say people who have this response, oftentimes they're trying to run away, right? You're running away from something, you're avoiding something. I just don't want to deal with it. Freeze, startled, not knowing what to do. Maybe you are, the what comes to my brain is sometimes in emergency situations, people simply freeze. They look like a deer in the headlights, are still not know what to do. Your brain just stops thinking. And then fawn is like what's the word, like pleasing, people pleasing, right? So admiring or giving compliments or doing everything that they are asking you to do, like, yes, of course I can take that onto my plate. Sure, you're asking me to do one more thing on, my list of already 30 things, of course I can do it, right? So saying yes, 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 not wanting to say no, not wanting to make someone else upset by your actions or your answers. Those are some of the things that can come up when you're looking at physical things, tangible things of responses to, I would say, trauma responses to what we're conditioned for. I don't know if that
Yeah.
answered your question.
No, no, I think it does. And I think if we
Okay.
now put it into like the practicality of it, so you might be in that board meeting or in that meeting, and it looks like agitation, anger. You want to yell at somebody. You don't want them saying that about, you don't want to make that decision. You don't want to have to do extra work. And so suddenly you're in this like rah kind of state. Doesn't mean you're an angry person. It could mean that there's been that reopening of something that is like enough already. I can't. And
Yeah.
so it's that angry one.
Yeah.
And then there could be the you're about to go in the room and you don't want to see that person. You've already had enough. And I just can't. And the avoidance. So the whole
Yeah.
just delay, defer. Just cannot make myself go in that room yet. I need another few minutes here before
It
I
can
could
come
even
up.
think about that.
Exactly. Yeah,
That,
unexpected responses, or I would say sometimes it comes up as you just don't hear an answer. You're like, I
mm-hmm.
keep texting this person and they're not responding, or I keep emailing this person and they're not
Yes,
responding. It's just silence, right? It
that's
could
right.
it could come
That
up as
what
something like that.
checked out. It could be coming up for you at home when your partner says, what do you want for dinner? Or what do you want to do this weekend? And your mind blank,
Decision fatigue.
just completely unable to figure out how to answer that question. I've already done a million questions today. I can't possibly think of another answer.
Yeah.
And just that flabbergasted as to why am I responding in this way? What is
Yeah.
happening here? Why can't I answer this simple question? Why can I look at this inbox for the next half an hour and not be able to get even one thing done here?
Yeah. Um, so I mean, I'm really glad we dove deep into this because I think it is really important and part of our everyday responses that we might see in our colleagues that we maybe mislabel as, use any word you want, right? Difficult position or challenging or anything that is not the norm of what expected of us saying yes, yes, yes might be mislabeled as that. And so it is very interesting because um I think part of this has also been redirected and used as a weapon against a lot of physicians too, to try to keep doctors doing the things that maybe others want them to continue to do. I don't know if that makes sense.
Yeah, yeah. Or even noticing the strategies for, somebody hasn't got their inbox empty for so many days. So we'll go and we'll add punishment to them. We'll fine them or we'll take them out of, do something to them so that they get that done. And it causes further harm
Yeah,
rather than the pause and say, how are you? What's happening?
exactly.
And that pressing in to just check in on them before we decide for them and pounce.
Yeah.
Hmm.
Um, we teach so much around trauma informed care for physicians and all of the same concepts. Um, I should say for physicians, for patients. Um, all of the same concepts apply to physicians themselves. And so I think it's really interesting when we're, kind of taking this next step is how we can have institutions be supporting for example, exactly what you said, a doctor who maybe has had 3 weeks worth of charting that's backdated. The question of why aren't you doing this? And reframing it to what's going on and how can I help?
Hmm. Yeah, that's right. What do you need to be successful here? What's happening for you? What's life look like right now?
Yeah.
Yeah, such a different approach than let's just beat that some more. Thank you for
Um,
this conversation,
yeah.
Cynthia. This has been good. Anything we didn't talk about that you want to mention or tell people about?
I think the big takeaway, that the message I want everyone to know and hear here is that medicine is sustainable and it is possible to create a career and life that you love and enjoy. And sometimes it does take a lot of work in looking at redefining, recreating what that might look like for you, whether it's looking at your identity shifts. I know we talked a little bit about that, right? Or what does it mean to be a physician to you? Like, what do you love doing as a physician? Um, I, as a physician, did not think, I'll tell you, I love being a family physician. I did not know that seeing patients every single day when I first started medicine was not something I wanted to do, and I needed a little bit of creativity and variety in my week. And that was a process that for me, in terms of redefining what it looks like to be a physician, I think that continues to happen. So I think those are questions all of us can ask ourselves is if you're not happy with how things are going, what would make you happy? And how can we help you redefine what that could look like so that you continue to stay and practice either clinically or non-clinically in medicine, whatever you love doing, but whatever that might look like, that sustainability is possible.
Love it. And how can people find you if they're looking to work with you or find out more about your retreat?
Yeah, everything can be found on my website at www.thrivationcoaching.com, or you can email me at thrivationcoaching@gmail.com.
There we go. Perfect. Well, thank you so much, Cynthia, for this conversation. And to all of you out there who are wanting to look for something different, make things more sustainable, keep looking. We can absolutely help you find other ways to help you in your clinical day. So love it. Thank you again, Cynthia, for coming along.
Thank you.
Bye, everyone.
Hey, if you found this podcast episode helpful, I would encourage you to like and subscribe. Every time you do, you help a colleague or friend find our podcast, and it can help them too. Don't forget to share it along with your friends. If you're looking for extra help, don't forget we have charting champions for physicians and smarter charting for nurse practitioners and other clinicians to help you get home with your work done. We are helping you create sustainable clinical medicine. Thanks for listening.